Greetings. I want to teach you about at least 10 pregnancy tips or 10 healthy pregnancy tips. 10 healthy pregnancy tips. I may go beyond that. Number one, do scan early. Do scan early. Once you notice you are pregnant, you are expected to do scan at 8 weeks. Make sure you do that scan at 8 weeks. You know why? That is when you will know your true EDD, right? That's when you will know your true EDD. That is the expected date of delivery. That's when you will know your true EDD. Because subsequent scans you'll be doing may not be correct. The EDD will keep on changing. That's what I mean. I don't mean they not correct, but the EDD may not be correct, right? The EDD may not be correct. So that's what you should do. Do scan early. It will tell you the EDD. So when you are having conflicting EDD, right? What will happen is you fall back to your first scan, and that is the one you will use. That's one. Number two, start antenatal early. Start antenatal early. There are some tests they will do for you that are very important. Your blood group, your genotype, your retroviral state, whether your HIV status, your blood level, that is your PCV. They'll check your PCV. They'll do hepatitis B and C test for you to know your status so that if it's positive, they will know what to do, right? They'll do syphilis test for you. They call it VDROL. They will even check for okay, I've mentioned blood group. Apart from the scan, they will also do urinalysis for you. They will also give you health education, tell you what to do, danger signs of pregnancy. You'll be given tetanus injection. uh So that's what you will do. That's what they do for you during antenatal. And make sure that you are going for your antenatal as regular as possible. eh. This will help you have a healthy pregnancy. Number three, ensure that that's what I think anyway. You register in at least two hospitals. Um, if you have a teaching hospital in your area, register there, or in a general hospital, register there. Then register in another hospital that is very close to you. The hospital you are registered in, you are doing antenatal should be at least close to you. Because sometimes you may have an emergency, you will not be able to rush to the one that is far, right? It's the one that is close that you'll go to. So please register in at most two hospitals, making sure that the one you are one of the hospital is very close to your where you stay. It's very even though it's a private hospital, but make sure it's a standard one where they have a doctor on ground and nurses. That is that. Number three, make sure that the medication they gave you during antenatal, your routine antenatal drugs, you are taking them. Make sure your routine antenatal drugs, you are taking them. Your folic acid, your vitamin C, vitamin B complex, your fesolates. Make sure you are taking them as prescribed. Make sure you are taking them as prescribed. Very, 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 very important. Make sure you are taking them as prescribed. Don't go about missing some of the doses. Take your folic acid, take every. If you have any complaint about them, let your doctor know. Don't say because it makes me vomit or I don't like this medicine, just dump them somewhere. There's a reason you are giving folic acid. It's very important you take those drugs. That is that. Number four, okay, or number five. Okay, number five. Do some that if you are pregnant and you notice that in your previous pregnancy you have been having multiple miscarriages and you are pregnant now, what you should do is stay in one place. Don't be jumping from one keke to the other, from one vehicle, one cab, one bus to the other, rushing, trying to hustle. Stay in one place. I know you need to hustle, but reduce your stress. Stress can cause miscarriage. Reduce your stress. It's very important. This thing I'm telling you, very, very important. Reduce your stress. Reduce your stress. It's very important you reduce your stress so that the likelihood of miscarriage happening again will be very slim. You get? Reduce your stress. uh, drink a lot of water. You can take fruit juice. You can take yeah, fruit juice. I don't want to mention any name. Fruit juice, water is very healthy. Make sure you are taking. Don't be dehydrated. Don't be dehydrated at all. If you are pregnant and you are that you notice issues can come up. You may be pregnant for the first time and you notice that you are hypertensive, you are diabetic, no problem. What you will do is make sure that the medications they gave to you, you are taking them. No problem. Medications they gave to you are taking them. Very important to help you control the BP, to help you control the blood sugar. Very important. Then make sure that you maintain a good personal hygiene. Um, that you are pregnant does not mean you will now neglect yourself. Maintain a good personal hygiene. Very important too. Clean up yourself. Clean up yourself. Just change your undies, wear good clothes, make your hair and the rest. Don't make pregnancy look as if it's a punishment. And husband, assist your wife in doing things at home so that they will also have time to take care of themselves. I don't. It's not nice to see a pregnant woman looking haggard, hair scattered. I mean, it's not nice. Live your best of life. Then the food you should eat the normal food you used to eat. Eat the normal food you used to eat before you got pregnant. But this time, just make sure that you don't take alcohol, you don't smoke, you don't use herbs, right? Don't take alcohol, you don't smoke, you don't use herbs. Also avoid pineapple and zobo. Avoid zobo. They have been shown to cause miscarriage, so avoid them, right? But eat your normal food, pounded jam, rice, beans, fufu, amala, ewedu, whatever you want to eat. Egusi soup or guano soup, apples, oranges, and the rest. Enjoy yourself, eh? Eat your normal food. I think I've even gone beyond the 10th number now. Then you can exercise a little. Exercise a little. Exercise. Don't do too much exercise. Just walk around the house, do one or two sit up and the rest. Then once your pregnancy is getting to um, 20 weeks or you're in the second trimester, you should be lying on your side. This will help prevent encourage blood flow to your brain and to the baby. Because if you lie on your back, you can faint. You can become unconscious with that gesture. So by lying on your side, right? So that the womb will not be pressing on the blood vessel that supplies the brain, that takes blood back to the heart. And when blood is not going back to your heart, it can cause trouble. So lie on your side. Make sure that you do another scan. You can do a total of 3 scans, but there's no total number of scans you should do in pregnancy, right? If there is any issue, you don't feel your baby moving, you go and do a scan, right? Go and do a scan. Let your doctor know. If there's any infection, yeast infection, you notice you are having smelly discharge, treat it. Very, very important. Treat it. Don't wait. Don't, because it can cause miscarriage. It can cause miscarriage. Treat it. Treat it. Let your doctor know. Talk to your doctor. Talk to people. Talk to healthcare. Talk to a doctor. There's a reason. They will help you. Right? Then another thing is know the danger signs of labor. When if you notice you are bleeding through the vagina, go to the hospital. You are leaking water through the vagina during pregnancy. That's also a danger sign. Go to the hospital. You are having headache that is not stopping. Go to the hospital. Right? Those are the things you should do to have a successful pregnancy and have a healthy baby. And finally, some of us, yeah, pregnant women, some pregnant women make this very terrible mistake when it's time to deliver. They will tell them that they have obstructed labor, that their baby cannot pass through, or their baby is in distress, their baby need to come out. But what they do is they will not start becoming stubborn. They'll say they don't want CS. They don't want to do CS. Their grandmother did not do CS. Their grand grandmother did not do CS. Their mother did not do CS. Their sisters did not do CS. Why would they do CS? You, madam, you have obstructed labor. So do CS and let your baby be, so that you have a healthy baby. You will be alive too. If you don't do the CS, the baby cannot come out. And what will happen is the baby could die. And you too can lose your life. And even though when you now finally agree to do CS, the damage may have been done. That's what I'm trying to say. Some women with obstructed liver will now start leaking urine after delivery because the bladder was injured. You get? So please make that decision. Don't be wavy. Just know that this pregnancy I may deliver through vagina or I will do CS. Whichever one comes, you take it for your own good and for your baby's good. Do you have any questions? Thank you and bye bye.